The NHS is at its best when everyone feels included, patients and staff. So, how diverse is the medical workforce? We've pulled together UK data to have a look, and from this we've created the Equality Lens, an information resource for doctors, researchers and the public, which picks out key trends each year. We've started with gender and ethnicity, because these are the characteristics where we have the most complete picture. Let's look at the top 4. 1. Senior medics are mostly white male doctors. Last year, 66% of consultants were men and 34% were women. Among consultants, or those eligible to be appointed as consultants, 59% were white, 21% were Asian or Asian British, and 2% were black or black British. 2. More women are becoming doctors. When we look across all 4 UK countries, women make up 47% of the total NHS workforce. In some fields of medicine, women outnumber men, such as in general practice and paediatrics, perhaps due to better work flexibility. And for the last 4 years, more women than men have entered medical school, now making up 55% of medical students. 3. There's been little growth in the number of doctors from black and minority ethnic backgrounds over the last 5 years. The number of white doctors has increased 2% to 53% of the workforce in the past 5 years, and the number of Asian and Asian British doctors has increased just 1% to 23% of the workforce. The number of black and black British doctors has remained the same. In some specialties, like anaesthetics and public health, white doctors represent 2/3 of the workforce. 4. There are big gaps in the reporting of ethnicity across the medical profession. We don't have the full picture when it comes to our doctors' ethnicities. Unreported ethnicity across specialties can range from 12 to 23%. If doctors don't feel comfortable disclosing their ethnicity to their employer or regulatory body, we need to find out why. What can I do? We want to understand what these trends mean for women, black and minority ethnic groups studying medicine and reaching senior levels in the NHS. And we want everyone, including the government, training bodies and employers, to ask, what can we do to increase diversity among doctors? We don't have all the answers, but we're asking the questions, and we'll continue asking them to improve the diversity of the NHS throughout the UK.